Infectious disease specialist Dr. Todd Ellerin joins us now for more on these COVID-19 risks over the holiday. Dr. Ellerin, good morning. You know, people are traveling for Thanksgiving. What do they do once they reach their destination, or what should they do when they get there and when they get back home?
Good morning, Diane. It's always good to be with you. So here's a mnemonic to help people remember the important prevention measures. Thanksgiving Day visitors matter. So the T in Thanksgiving is testing. Ideally, you want to be tested before you reach the family, before you reach the household, and then after when you return. The H in Thanksgiving is hand washing. We've been saying that for a long time. Thanksgiving Day, the D is distancing. Physical distancing is important. Okay, you can't do that in a car ride if you're with another person, but when you get to that household, the tables ideally should be spread apart, not one table with people around it. Thanksgiving Day visitors, the V is ventilation. Open the windows in the cars as you're traveling, open the windows in the households wherever you're going. And then Thanksgiving Day visitors matter, that M is masks. Masks indoors, very important. We know from multiple studies, masking can reduce transmission by as much as 70%. That's a big number. So if we remember those things, you know, we should be in good shape.
Thanksgiving Day visitors mattered. By doing these things, we can show the people we're around that they matter, right? So how do you anticipate this Thanksgiving affecting the so-called curve? How could gatherings affect other upcoming holidays? And when we talk about the curve, of course, it's about overwhelming the healthcare system. What do you think?
Well, Diane, one of my concerns is, despite everything I just said before, is that Thanksgiving is a time when, you know, family gets together and, you know, you're as close as possible as a unit. And I'm just afraid, despite our you know, cautioning that a lot of people are going to be close, distance, unmasked inside. And so remember, we've seen it after Memorial Day, after the 4th of July. We've seen it after Labor Day. There's been major surges. And right now, you just heard, we've seen over 2,000 deaths in the United States in a single day. We're seeing around 200,000 cases in a single day. Our baseline is unacceptably high. I'm really afraid over the next month, in between Thanksgiving and Christmas, we're going to see some major surges.
Well, and what do you think happens come Christmas time? Maybe you don't know, but for people who are making the sacrifice for Thanksgiving, are they going to have to do this all over again in a month?
It's a really good point, what you're saying, right? What I do affects you. What you do affects me. Some of us are going to try our best, but if infection prevention measures are uneven, then it's inevitable that we're going to be in a potentially dark place come Christmas. I'm really afraid if we continue with business as usual, we're going to be seeing some shutdowns that are going to just worsen our pandemic fatigue and our pandemic frustration.
The CDC is reportedly going to shorten its recommended quarantine time for people exposed to COVID-19, as we heard Gio mention. And this gets into efficacy versus effectiveness, right? A quarantine is only effective if people are going to actually do it. So what do we know about the changes, and what do you think?
So I live in Massachusetts, so our state has just changed its quarantine guidance from 14 days down to 10 days, and I'll explain that to you. So I think, and this is based on what they knew the CDC was going. So the thought is, as you just said, a quarantine, if people don't quarantine, if you have quarantine fatigue, that pandemic frustration, then that's not helpful. The hope is by decreasing it from 14 days down to potentially 10 days or 7 to 10 days, we have to see where the CDC lands at, that more people will do it and it will ultimately be more effective. Okay, so what we know is that 90% of people develop symptoms by day 10. That's important. So what Massachusetts has done is they've said if you test negative by day 8, so you need that test by day 8, their thought is that many of us, it takes about 48 hours to get that test result. Then by day 10, you can come off of quarantine, assuming that you have no symptoms.
So they're not just arbitrarily shortening the time. They're doing it in a way where they think they'll still get a good amount of people limited, and they will know by then if they're sick or not.
exactly right. They're trying to find that sweet spot between what's going to protect the public and what are people actually going to abide by.
All right. It's a tricky business. Dr. Todd Elmer, we appreciate your help in figuring this all out
Great
and guiding us. Have a great holiday if we don't see you.
Happy
Thank you.
Thanksgiving, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.